Your upcoming visit to DHR Health Epilepsy Monitoring Unit. This video will help you prepare for your upcoming appointment. What is an Epilepsy Monitoring Unit? Our Epilepsy Monitoring Unit, also known as the EMU, was established to provide extensive monitoring to help further diagnose what type of seizure condition a person may be experiencing in effort to provide an individualized treatment plan for epilepsy. This extensive monitoring will be done continuously throughout your stay. Your duration of stay may vary from 2 to 5 days. Please plan accordingly to make your stay as comfortable as possible. Types of monitoring. Video recording, to provide visual of seizure activity to help us develop an accurate, detailed picture of your seizures. EEG recording. Electroencephalogram electrodes will be connected to your head to map your brainwave activity throughout your stay and correlate with video footage. Audio recording. Please be aware that there will be a microphone in the room to help us fully capture what is happening during the event. Cardiac monitoring, to monitor heart rhythm throughout stay. Setting an appointment. During your visit at Dr. Estefan's clinic, he will submit request for your stay at our EMU. The front desk staff will schedule this appointment for you. Once insurance approves the request, they will ask you to come pick up your orders from the office. We recommend to go directly to DHR Main Hospital and complete your registration so that you will not have to worry about it on the day of stay. Registration hours, 8 a.m. to 8 p.m. Contact number 956-362-7718 or 956-362-7716. On the day of your appointment, once we have your room prepared and our team is ready for you, the hospital will call and tell you what time to arrive. The times may vary, and rooms are normally ready after 1 p.m. When you arrive, please have your insurance cards and ID with you. Be sure to take your daily medications on day of appointment. Now that you have your appointment date, let's talk about how to prepare yourself for your hospital stay. Tips to help you prepare for your stay in the EMU at DHR. Wear comfortable clothing, noting that you will not be able to remove any clothing from over your head, as the EEG will be connected at all times. So we suggest button-up shirt that can be removed without pulling over your head. We do have tie-in-the-back hospital gowns available. Please bring your own toiletries and non-slip shoes or slippers. Please avoid bringing hair dryers and electric razors. We will provide the medicine you need during your stay. However, please be sure to pack your medications with list of dosages and schedules. This includes prescribed and over-the-counter medications. You can bring your own pillows, blankets, and stuffed animals if desired, keeping in mind we are not responsible for any loss. Bring plenty of entertainment, TV and Wi-Fi available, but we do suggest books, magazines, cards, board games, etc. Most importantly, don't forget your chargers. You can also bring your Fire Stick, and our engineering team can connect it to the TV in your room. We do recommend a family member stay with patient throughout stay. This will help to provide further input on what is typical and atypical for each patient. Wash hair night before stay. Avoid any styling creams, oils, or hairspray. We do not recommend braids as they will not be comfortable with EEG monitor connected. You can bring snacks and non-perishable foods if desired. What to expect during your stay. You will have a private room. Each room consists of video camera, microphone, and connections for continuous EEG and cardiac monitoring. The side rails of the bed will have special padding to help protect you during your seizure events. Please note, with continuous EEG monitoring, you will not be able to wash or comb your hair during your stay. You will have an IV in place. This will be checked by your nurse daily. This is helpful if we need to administer any emergency medications during your stay. Your nurse will check your heart rate, blood pressure, respiratory rate, and oxygen saturation every 4 hours, and more frequently during seizure events. Nursing staff must be present anytime you will be out of bed, such as restroom breaks. We encourage you to stay in bed as much as possible, as this is the safest place for when you do have a seizure. We will provide meals for patients, but not for family member. We do have several cafeteria options available at your convenience. Methods to induce seizures. Medications. We may decrease or stop your anti-epileptic medications during your stay, as this is at the doctor's discretion. Sleep deprivation, which means you may stay awake during the day, and we keep you awake till very late at night, where you only get a couple hours of sleep. This lack of sleep can increase your chance of seizures. Photic stimulation. We could use a flashlight to provide flashes of light in a pattern, much like a strobe light while your eyes are closed. Hyperventilation. This is a deep breathing technique that alters your pH, and this can induce a seizure as well. What to do while having an episode in the EMU. Your safety is our primary concern. We recommend patients stay in bed as much as possible. There is a seizure button. If you feel as if a seizure is going to start, press this button. If you are unable to press the button, we will instruct family member to press button if any event may arise. Family member and staff are to be aware of camera and avoid standing in way of visual footage. Also note the microphone in the room. Anyone can speak to the things occurring to help clarify events. Our nursing staff will observe, assist in providing oxygen if necessary. For each event, your nurse will ensure you are laying down and then roll you to your side to ensure your safety. Our nursing staff has strict instructions on how to proceed if any unwanted problems may arise. Discharge from EMU. Once Dr. Estefan obtains desired information to create your individualized treatment plan, we will begin the discharge process. Keep in mind, it can take anywhere from 2 to 5 days for the desired information to be obtained. You will resume your medication regimen and your IV will be removed. You will be scheduled for your follow-up care accordingly. Don't forget your belongings. When to call your doctor. Any unusual or new seizure activity, any increase in the number of seizures or ongoing seizures, excessive drowsiness, confusion, excitement or restlessness, behavioral, mood or mental changes. You know your body best. If you feel as if something is off or wrong, please contact your epilepsy clinic so we can further assist you. Dr. Estefan's Clinic, DHR Health Neurology Institute, 956-362-8500. When to call 911 for seizures, difficulty breathing or wakening after seizure, seizure lasting longer than 5 minutes. Another seizure occurs directly after previous seizure, when any injury has occurred due to seizure. Thank you for choosing DHR.